Tonight, the future of Medicaid is up in the air as Congress debates deep cuts tied to the federal budget. On Capitol Hill, marathon hearings are underway after House Republicans released their budget plan Sunday, proposing $880 billion in cuts to Medicaid. The move could impact millions of low-income and disabled Americans. Protesters blocked the doors to one of today's hearings. The proposed reductions are a key part of the big, beautiful bill President Trump is pushing to fund his agenda. In Folsom today, dozens of people protested these exact funding cuts. ABC's Becca Habecker spoke with them and also took their questions straight to Folsom's congressperson.
Whose care? Our care!
Medical providers, patients, and advocates gathered outside Dignity Health Mercy Hospital in Folsom Tuesday afternoon, protesting proposed cuts to the federal Medicaid program, which in California operates as Medi-Cal.
We must have this money. People must get the health care they need.
Dr. Kimberly Bust is a longtime family physician in the Sacramento area. Medi-Cal serves more than a third of the state's 39 million people, and Dr. Bust says cuts would hurt everyone in California, not just those on Medi-Cal.
What happens if your hospitals or your clinics or your health systems don't have Medi-Cal money? They have to figure out a way to get that money to provide the care they need. And so that means that costs get spread to all people. We all pay the price.
Protest organizers say some $380 million come to hospitals here in Republican Representative Kevin Kiley's district. Money specifically from Medi-Cal, which is why Dennis Wilson, a clinical laboratory assistant here at Dignity Folsom, worries about his patients.
We see people every single day, and they are at their worst moment. They're fearing for their health. The last thing they need to do is be in terrifying fear over the damn bill.
So I took that concern directly to the congressman.
If these cuts are made, is there a plan to address medical debts for low-income and or vulnerable people here in California?
No, there's nothing in this legislation that would cause those populations to lose access to their benefits. The only risk to the federal funding for eligible beneficiaries that California deserves is that the governor and legislature have decided to have a unique policy that exists nowhere else in the country of making every single undocumented immigrant who meets the income requirements eligible for Medicaid.
Starting in 2024, California expanded Medi-Cal eligibility to include all low-income undocumented immigrants, a controversial move that Republicans say is to blame for Medi-Cal's recent solvency issues. The state has had to use more than $6 billion from the general fund this year just to keep the program afloat through June. The governor's office has said the ballooning cost of Medi-Cal has more to do with prescription drug prices and increased enrollment across all populations, not just undocumented immigrants. Regardless, California's policy is jeopardizing Medicaid funding, Kiley says.
So I didn't come up with this provision, but it's in the bill. It says that if your state is using its dollars to fund Medicaid for those who are in our state illegally, then you'll have your federal FMAP for the expansion Medicaid population reduced from 90% to 80%.
ABC 10 reached out to Governor Newsom's office for a response to Kiley. We did not hear back by deadline.
It's the governor right now who is the biggest threat to Medicaid in our state.
And MRI
Protesters here say Kiley and his Republican colleagues are the ones who should change the proposed federal cuts to protect coverage for patients like Joe Metters of Citrus Heights.
As a person with diabetes and has gone through couple strokes in my lifetime and high blood pressure, I depend on Medi-Cal to support because to have a quality life in my community.
In Folsom, Becca Habecker, ABC 10.
The budget process is still in the early stages. The bill must pass the House, then the Senate before reaching the president's desk.